Here is your question. Oops, I'm sorry. Okay, so if you have read and understood, considering it surgical pathology station, kindly tell me what would you suggest the provisional diagnosis of this condition is for this case?
Yes, ma'am. The differential diagnosis would include multiple endocrine neoplasia type 1. It could be pancreatic mass, and it could be uh, uh, gastric mass as well.
Okay, how would you confirm your diagnosis?
Okay, so, madam, I would do the biopsy of the peripheral gland.
Okay, and any other investigations you'll carry out,
Yes, FNAC of the peripheral.
right? What are
Other than
the
this, madam,
yes?
I would do the biochemical investigations that includes urine and electrolytes as the patient suffering from profuse vomiting and diarrhea
Okay,
and serum calcium as well.
right. Can you tell me what are the conditions which can result as a once you'll receive your result of the labs that you'll ask for?
Sorry, ma'am. Can you please ask the question?
Once you'll get the lab back, what are the conditions that you can consider that patient might be suffering from? Or what do you
Yes,
expect to see in the labs that you'll request?
the patient could have hypocalcemia as the patient is suffering from hyperparathyroidism, and the
Okay,
patient can be having uh, decrease in the potassium levels as the patient suffering from diarrhea.
okay, right. What
Yes.
management can you suggest to the patient?
Okay, so, if the patient is having persistent vomiting diarrhea that requires resuscitation, emergency room, that requires bilateral IV cannula placements and fluid resuscitation. And for the epigastric pain, he would need IV painkillers.
Okay,
And
right.
yes,
Are there any blood markers that you'll rule out or you'll investigate?
yes, for the pancreatic mass, I would do the insulin levels
Okay,
and the insulin to glucose ratio.
yes. What do you think this CT scan with enhancing pancreatic lesion shows?
But then this would be insulinoma.
Okay. What management options can you offer to the patient?
Uh, yes, at this point, if the patient is coming to here, I would give the emergency treatment by giving IV fluids, painkillers. But in the long term, I would ask him to offer him short meals per day.
Okay. Can you tell me how many types of hyperparathyroidism there are?
Yes, ma'am. There is primary hyperparathyroidism, secondary hyperparathyroidism, and tertiary hyperparathyroidism.
Yes, what are the differences among these?
Yes, the primary hyperparathyroidism, that could be a functional adenoma that secretes parathyroid hormone and that causes increased level of calcium in the blood stream. In the secondary hyperparathyroidism, there has to be a secondary cause that is commonly chronic kidney disease or renal failure that leads to persistent elevation of parathyroid hormone to excrete the phosphates. And in tertiary hyperparathyroidism, the chronic kidney disease is managed. And due to persistent elevation, a persistent stimulus to the parathyroid gland, the parathyroid will be enlarged and adenoma will be formed.
Okay. What other conditions would you rule out considering that it's a male patient and is suffering from hyperparathyroidism?
Can we skip to the next question?
Okay, right. What are the types of men 1 and men 2 conditions that you are aware of?
Uh, Men, then it includes the pituitary adenoma that includes functional tumor of the prolactin disappears. Other than that, there will be pancreatic lesions that include seminoma, and the other would be parathyroid adenoma. In men too, there would be medullary carcinoma of the thyroid gland, and there would be pheochromocytoma, and the other would be parathyroid hyperplasia that causes hyperparathyroidism.
Okay, can you tell me what do you understand by the von Hippel-Lindau syndrome? Would you consider it among men 1 syndrome or men 2 syndrome?
Uh, I think it's in men too.
Okay, right. What more I can? There is still 2 minutes left. Okay, how would you plan to follow up this patient after management?
Okay, so uh, after treating the hyperparathyroidism in this patient, the regular calcium level should be monitored,
Yes,
and
how? Yes.
the serum calcium should be done routinely to check for the hypocalcemic state. And other than this, I would ask the patient to check his glucose level routinely.
If a patient has a family history of hyperparathyroidism, when do you think should or be the appropriate age to start follow up? From the age 8 onwards, and
Yes, ma'am.
screening should be done every 5 years if patient's condition is normal. Otherwise, you can increase the frequency. Okay, right. What should be the clinical manifestation of MEN2 syndrome?
Uh, it could be when it comes to mental syndrome, could be the manifestation from the pseudocytoma. It can present with the malignant hypertension
Yes.
and hypertensive emergencies and emergencies. Other than this, there could be the hypercalcemic state and manifestation of hypercalcemia that includes seizures. And other than this, there would be uh, uh, recurrent admissions related to chest pains and hypertension.
Good. Thank you.